Hi everyone, in this video we will see about the colonoscopy procedure and its CPT guidelines. First, before starting with the video, I'll tell you what is this colonoscopy. Colonoscopy procedure is done in cases of patients who are having problem in the large intestine. So you should know the proper anatomy of large intestine and what all diseases will be either diagnosed or treated with colonoscopy. So all of them you should be knowing. And before that, we should know how it is done. So colonoscopy is a procedure which is done by inserting a camera inside the rectum and the colon. That means the whole of the large intestine will be visualized using the endoscope. Apart from that, we have sigmoidoscopy, which is helpful in checking only the sigmoid colon and the rectum. And also some portion of the descending colon will be examined in the sigmoidoscopy. And there is another procedure which is called as proctosigmoidoscopy, in which mainly they will be checking only the rectum and sigmoid colon. So these are the endoscopic procedures that are done for the large intestine. With the help of such endoscopic procedures, we can do diagnostic and therapeutic procedures as well. Diagnostic procedures means procedures which are done to find out the problems, but therapeutic means treatment procedures like surgical procedures that are done in the large intestine. So all of the procedures will be covered under this proctosigmoidoscopy, sigmoidoscopy or colonoscopy. But in our CPT book, we have some guidelines for this colonoscopy procedure. So now in this picture, you can see how a colonoscope is done and for what conditions it is done. You can see a flexible wire that is inserted inside the large intestine, and with the help of it, they can diagnose problems like ulcerative colitis, Crohn's disease, diverticulosis, cancer conditions, and also polyps. And also sometimes treatment procedures are also done for these diseases like ablation of tumors, excision of tumors. So they use many procedures in addition to this endoscope to do some treatment also. So now we will see the parts of the large intestine. Large intestine has got cecum, ascending colon, transverse colon, then descending colon, then we have the sigmoid colon, and after the sigmoid colon we have the rectum. But here you should remember that at the junction of ascending and transverse colon we have a portion called as hepatic flexure. Just above that we have the liver. Just like that, on the opposite side between the transverse colon and descending colon we have a portion called as splenic flexure, because the organ spleen is just present above that. And you should remember this while you are coding for the colonoscopy procedure. So you have to check whether the scope has crossed the splenic flexure or not. If it has crossed the splenic flexure, it will be considered as colonoscope. But if the scope is not crossing the splenic flexure, it will be just considered as a sigmoidoscopy. That is a very important guideline that has to be followed when we are reporting this colonoscopy procedure. And in our book, we have a colonoscopy decision tree, in which you can find two types of colonoscopy procedures. So whether it is a diagnostic procedure or therapeutic procedures. So first we will divide it like that, and after that you have to check what all portions of the colon or the large intestine were checked with the help of the scopy. Based on that we can report the codes, and also we can use some modifiers there. First, let us see the guidelines for diagnostic procedures. If it is a diagnostic procedure and the scope does not reach the splenic flexure, how will it be considered as? It will be considered as a sigmoidoscopy. It will not be considered as colonoscope, it will be considered as sigmoidoscopy. And for a diagnostic sigmoidoscopy procedure, we will be using the code 45330. So now we'll move to the next point. If the scope has crossed the splenic flexure but not until the cecum, that means it has entered into the transverse colon, but it did not reach the cecum, then how will you report it? You can report it as a colonoscopy procedure, but here you have to give the modifier 53 along with the colonoscopy procedure to say that this is a discontinued procedure. So maybe later doctor will be redoing it. So that is why we are using this modifier 53 here to say that the procedure was discontinued. But if the colonoscope crossed the splenic flexure and it went till the cecum, then it will be considered as a complete colonoscopy procedure, Here you don't have to give any modifier, and if it is a diagnostic colonoscopy, we have to report the code 45378 without any modifier. So that is all about diagnostic colonoscopy. Now we'll move to the therapeutic colonoscopy. If a therapeutic colonoscopy is done and if the scope does not reach the splenic flexure, again it will be considered as a sigmoidoscopy, and you have to report the codes for sigmoidoscopy as 45331 to 45347 depending upon the surgical procedure or treatment procedure that is done in addition to the scopy. Next, if the scope has crossed the splenic flexure but again it did not reach the cecum, again it will be considered as a colonoscopy, but here you have to use modifier 52 because this is a therapeutic procedure and the doctor is reducing the service. That means he is not fully doing the service. Then we are using this modifier 52 to say that the procedure was reduced by the doctor. So you have to give colonoscopy codes along with modifier 52. Next, if the scope has reached until the cecum, that means a complete colonoscopy procedure is done. Then you don't need any modifier. Just report the specific code that is needed for the particular procedure that is done along with the colonoscopy. So this guideline is very, very important for the exam, because in the exam many times they ask a separate question or a coding guideline question like this. What is the modifier you will use if the colonoscope does not reach the cecum but it has crossed the splenic flexure? And if it is a diagnostic procedure, what is the modifier you will use? And if it is a therapeutic procedure, what is the modifier you will use? And in cases also you can expect questions from this colonoscopy procedure. They will mention that the procedure was discontinued because of the hard stools that was present in the colon. The doctor planned for a re-procedure. Like that they will mention something. Again you have to check whether it is diagnostic or therapeutic. Based on that you have to give the modifiers 53 and 52. Remember that 53 is used here for diagnostic procedure and 52 will be used for therapeutic procedures. If you remember this, you can surely score 1 or 2 marks from this colonoscopy part. Hope this video will be helpful to you. Please don't forget to subscribe my channel, and thank you.